Welcome to this presentation. My name is Michael Collard, and I'm the Marketing Manager for Meditech Group, working with their amazing Optifa series of natural heme iron supplements. I will speak about chronic heart disease and how it relates to anemia. Heart failure is a very common disease, with severe morbidity and mortality, and is a frequent reason of hospitalization. Anemia and a concurrent renal impairment are two major risk factors contributing to the severity of the outcome. Anemia in heart failure is complex and multifactorial. Hemodilution, absolute or functional iron deficiency, activation of the inflammatory cascade, and impaired erythropoietin production and activity are some pathophysiological mechanisms involved in anemia of heart failure. Cardiovascular diseases are among the most frequent causes of death worldwide. Heart failure is an enormous medical and societal burden and a leading cause of hospitalization. It is estimated that 2.6 million hospitalizations annually in the US are due to heart failure as a primary or secondary diagnosis. Anemia and a concurrent renal impairment are two major risk factors contributing to the severity of the outcome. Anemia is common in patients with heart disease. It is present in approximately 1/3 of patients with congestive heart failure, CHF, and 10% to 20% of patients with coronary heart disease, CHD. More than 1/4 of the world's population is anemic. Approximately 1/2 of this burden is a result of iron deficiency anemia, being most prevalent among preschool children and women. The diagnosis, prevention, and treatment of iron deficiency is obviously a major public health goal, especially in low and middle-income countries. Anemia of chronic inflammation is the most common cause of anemia and occurs in 58% of heart failure patients with anemia. Anemia of inflammation and chronic disease is a type of anemia that commonly occurs with chronic or long-term illnesses or infections. The absorption of heme iron is several times higher, and the side effects rate significantly lower than for non-heme oral iron. Heme iron is absorbed through a separate pathway and does not have to be discontinued when intravenous treatment is started. This can allow for longer intervals between resource-heavy, inconvenient, and painful injections. Oxidative stress is also avoided. Take good care of your iron levels so that you can live your life to the fullest. Find Optifa at Amazon.